Okay, first of all, thank you to everybody. And I will speak again about Lipogems. That is a kit, as you all you know, to prepare a better lipoaspirate. It is a closed processing system based on a disposable unit that resizes the adipose tissue cluster to the best size possible to engraft, which is about 300 microns, 0.3 millimeter. Also wash out most of the inflammatory parts, like the oil, blood, and cell debris, and preserve tissue and cellular structure integrity at best. And this is because of the liquid protection, which is the key of the system. As probably you know, Lipogems has worked a lot in distinguish itself by strong scientific and clinical evidence. There are more than 90 now peer-reviewed publications published, 38 ongoing independent studies in orthopedics, but not only orthopedics, and also 13 ongoing basic science studies that support the logic of the clinical studies. About the clinical studies, there are many important research trusted partners that are going on in this. But what I want to say in this presentation is to speak about the main concept of the Lipogems system. The main concept is to resize the adipose tissue cluster that are taken by the cannula. The cannula cannot take piece of fat that are smaller, intact piece of fat smaller than about 3 millimeter. If you take smaller pieces, they are mostly dead. And this piece of 3 millimeter are too big to have a strong regenerative effect. So you have to reduce them, and to reduce them is essential to make it in a liquid environment without any air. Otherwise, they explode. And what you obtain is what you see on the lower right are little pieces of fat which are covered by intact capillaries, which are by themselves covered by pericytes that you all know what they are. What is essential here is to understand that this maneuver creates a natural surface expansion, cioè the expansion of the surface is huge. If you think that a reduction of 10 times the radius increase the total surface about 6,000 times and makes available all the pericytes, all the capillaries to be available for a better biological buster. Microfragmented fat, so I think, is an ideal lipoaspirate preparation for different reasons. First of all, it has the optimal viscosity for a small gauge needle like a 22 to pass through, as you see on the bottom right, and is made to engraft in the recipient tissue, working as a regenerative tissue for a long time. As said before, it increases the microvascular density, and that is the key, in my opinion, to its goal. And these are very natural bioreactors. The first presentation was about a scaffold that keep a collagen scaffold that keep the PRP for a longer time, and this is a natural scaffold that keeps the capillaries and the MSC for a long, long time. It is 100% live adipose tissue, ideal size to obtain grafting, and the key is preserve cell and tissue microarchitecture, and also reduce quantity of impurities that cause less inflammation while you use it. This is very important to understand Lipogems. As Kaplan and Conrad has said, is isolated MSC manage the injury response by cytokine secretion. Lipogems done the same for a much longer time because the tissue, Lipogems tissue, is an adipose tissue graft, and so the microvascular density is permanently increased. Remember that the difference, the way you heal when you are at 10 years old and the way you heal now, is because of the vascular density. You have a reduction with time of the vascular density. So it's not the old lady that became a child, but it became to heal like a child. And this is how it works, the regenerative process during time. Any acute injury, think about shock waves, think about prolotherapy, create a controlled inflammation, which is mediated by substance, which in turn activates regeneration, which is mediated by cytokine, that can be a perfect healing or leave some fibrosis. What Lipogems does is to increase the cytokine of regeneration and to decrease the one of fibrosis. And this is an interesting, very interesting point because it's the same in any tissue in which we have treated with Lipogems the atrophic vagina. And what you can see is that at 3 years and over, you have resolution of most of the symptoms and an increase in the vascular density of the stroma. What is also very interesting is that you don't have any fat in the stroma of the vagina, and on the right you can see that the fat stayed there for more than 3 years. And another follow-up paper has shown that also the clinical results improved constantly in all patients for at least 3 years. Why I speak about vagina while in this congress about joints? Because with joints, what we have seen is exactly the same. Both the joints, the wounds, aesthetic continues to improve with time. And this is unique, in my opinion, to Lipogems because it is a graft.
Professor, I'm sorry, but we lost your slides, like last 2-1. Can you just share the screen again, please?
How can I share the screen again?
As before.
Okay, it's gone.
Oh, a little bit. Don't worry.
Sorry. Okay.
Just a second.
You see the screen?
Yes, I confirm. Just please start last 2 slides. Just two last slides.
Okay.
This one, I think, is the correct one.
This one?
Yes, please.
Okay.
Thank you.
I go on fast. What I show this because it's very interesting because it's the histological evidence of true regeneration at 3 years. And a follow-up study of more than 50 patients show that also the clinical improvement is progressive. It continues to improve for at least 3 years. And this is seen also in other clinical applications like joint regeneration, wound healing, aesthetics. Always the result at 3 years look better than the result at 6 months. This is an example. What I say that the key to Lipogems action is long-term increase in the vascular density. You can see that this is 8 years apart, and you see that is evident that you have a better vascularity of the skin. This is 2 treatments of Lipogems. And I completely agree with Conrad that it's very important to have multiple injections. Now, I treat very severe cases also of arthritis, and if you do multiple injections 1 year or 2 years apart, you see better and better result. Another very important point in Lipogems is a strong reduction in scarring, especially in super difficult cases like chemical burns. You see that the guy on the left has received a chemical burn, and because chemical burn completely block the regenerative enzymes, after 6 months, he has a very, very scarred face. He came to Milano by a non-profit organization, and I helped him to regain an acceptable face. But what was impressive is that the scar really melted. And I regularly use Lipogems to help in my surgery, any kind of surgery. This is, for example, is maxillofacial surgery. This kind of result were impossible even a few years ago because you don't have the regenerative potential of Lipogems to help in postoperative healing. And this is a recently published paper that I found super important, and you should read it because it is a randomized study, very strong evidence, and a very strong result, because when you have you do an amputation on a diabetic foot, you always have problem in the stump. Using Lipogems, this problem are less than 20% in a blinded study, without using Lipogems, you have more than 85% necessity to amputate again. So the key question now is not this that I've said, but why and how Lipogems is different from stromal vascular fraction, both enzymatically or mechanically obtained, and from standard lipoaspirate. Why Lipogems can be the ideal way to deliver MSC long term. First of all, the difference with stromal vascular fraction is important. First of all, the stromal vascular fraction, you have a complete destruction of the structure of the fat tissue. So you have not the scaffold, basically. And this is why Conrad add something to the stromal vascular fraction, in my opinion. Second, stromal vascular fraction cannot engraft successfully and cannot have a very effective long-term effect, because it is progressively cannot stay there. It's like the PRP. And what is important is that also stromal vascular fraction can be used to produce expanded MSC. And we have to see if expanded MSC are better or not in comparison to stromal vascular fraction. We have some papers. One of the most important is the one on stem cell translational medicine by Bruno Peolt, that shows that if the healing is mediated by the secretion of cytokine, as we all know, Lipogems, the intact microfracture fat, has a higher secretory activity if compared to stromal vascular fracture. And also another paper on cellular 4 show that the exosome secreted by non-enzymatic method are much more than the one secreted by enzymatic. So when you use enzymatic destruction, is absolutely more harmful to the function of the cells than to keep the niche intact. So the Ministry of Health in Italy has done a research on rabbit that have compared culture and have used the fat pad that are present in the inguinal body of rabbit. You can take it and you have an enzymatic stromal vascular fraction, and then you culture, or you have a mechanical treatment and you have microfracture fat. And the results were very impressive because all three methods worked if compared to the control, but with microfracture fat, you have a more normal cartilage regeneration than compared to stromal vascular fracture culture expanded. And this was confirmed also by a second paper that is just come out with the first author is Giuseppe Filardo, that was present also in this paper. But Lipogems, I say again, is not, absolutely not, a way to obtain a mechanical stromal vascular fraction. Lipogems are small clusters of adipose tissue. You see in this picture that was shown also by Arnold Kaplan. And I can see this is banked cryopreserved lipogems. So both fresh and banked lipogems can produce culture expanded MSC. Cioè they produce the cluster cells over a long period of time. And this is probably the reason why it works so well in vivo. But now the most important point is to understand why Lipogems is different from standard lipoaspirate. Lipogems is adipose tissue. It's very similar, but has a much stronger natural regenerative property. Why? Because what we have seen is that we have an immediate secretion of anti-inflammatory cytokine just in minutes. And in normal lipoaspirate, you see it in days. There is no oil and blood debris and washing away because of the washing away of inflammatory cytokine. So you have minimal swelling when you use together with surgery. Not only you have minimal swelling, but you have less swelling than with surgery alone. When I do facelifts, now I always use Lipogems to minimize swelling. And the most important, you have a very rapid engraftment in difficult areas and a prolonged survival. So this is why we have a long-term regenerative effect. And is also important is the absence of fibrous strands that made the injection easy and with no lumps. These are the three most important papers that show why Lipogems is different. Why? It shows that Lipogems is different by normal lipoaspirate. And the reason is because normal lipoaspirate is not microfractal and there's not a huge surface of interface. So it cannot work as well. One of the most important is the one published on British Journal of Anesthesia that shows that Lipogems blocks the inflammatory cascade of sepsis, while the normal lipoaspirate is just very, very similar to the control. This is interesting because if you remember, the COVID-19 is just an inflammatory cascade. So this is the mechanism why MSC block inflammatory cascade. I go on because we are late, and just to remember that microfragmentation preserves cell and tissue microarchitecture and removes cell debris, oil and blood, increase vascular density, is cost-effective and compliant with FDA guidance. Centrifugation, that is a classical technique, yields a tissue composed mostly of large tissue cluster. If you try to take a smaller tissue cluster with a cannula with small holes, you have a lot of dead tissue. And if you don't, if you keep the large cluster, you limit the functional ability. What I don't like at all is nanofat, because it's an emulsification. If you pass through 2 syringes many times, you don't have normal fat. You have all the cell are destroyed, and you have a mechanically obtained stromal vascular fraction. No scaffold holding component, so you have a much, much less effective clinical result. It may also not meet 361 guidance because it's not normal fat. The stromal vascular fraction isolation is the classical way, is not FDA approved at the moment, is not minimal manipulation, and does not retain the structural element of fat. It's time costly and expensive. Is put together with fat may be very useful, but we have the problem of the regulatory environment. So what is my experience in years in my clinic, image regenerative clinic in Milano, is that Lipogems treatment as a low trauma harvesting, also for old and fragile patients, very good biologic power, even in old age, and I use now in also very bad joints. I only advise the patient that I have to do multiple times, and I have to say that very, very few go on joint replacement. One of the most important possibilities is to treat multiple joints and different areas at the same time. So in very old patients, for example, that have one knee that is sure that he needs a joint replacement, but he doesn't want, you can try to do both knees. The one that is less affected usually heal completely. The other one, you need to do multiple injections to keep it from going to surgery. Short operative time in a surgical ambulatory setting. With 3 operating rooms, you can do up to 30, 40 cases a day. Easy ultrasound visualization of the Lipogems tissue, no post-operative morbidity. The patient go immediately at home, and there is no problem for clearance for intraarticular injection. There is still problem in Switzerland, I don't understand why, but in Italy and France and Great Britain, thanks God, not. I use now a lot, I do a lot of spine injection. The facets can be easily done under ultrasound. And I like very much to treat multiple joints together. In my practice, the median for each patient is 4.6 joints. And this is the way to obtain a very satisfied patient. Because even if the worst joint doesn't heal, he has the other ones that are healing. Thank you very much, and I hope to be in time.